Hi everybody, thanks for joining us here on Optometry TV. I'm Kara Moore, joined now by Dr. Agustin Gonzalez. Thanks for being here.
Thank you for the invitation. Glad to be here.
We are talking about glaucoma and whether
Yes.
this is becoming really a public health crisis. And I guess you can ask that because the glaucoma population seems to be increasing. Is that right?
So yes, with the increased longevity in the American population and glaucoma, is not that glaucoma is increasing, it's that the people with glaucoma, the pool of people with glaucoma has been increasing. And this poses a phenomenal opportunity for optometry. When we think that ophthalmology residencies have been cut down a little bit, the amount of ophthalmologists needed to be taking care of glaucoma has decreased a little bit, and the optometric population has actually increased. This situation provides a unique opportunity for optometry to be handling glaucoma patients. We know that glaucoma patients are underdiagnosed or undiagnosed, and we have a lot of data in public studies that point to that fact. We know that optic nerve evaluations not being done correctly by both optometry and ophthalmology. And there's a great opportunity for optometry to be able to create a big impact from a public health perspective in this disease, not only by diagnosing early, being able to manage, but also because of the distribution of optometry in the nation. The fact that optometrists account for 85% of patient care in the United States for primary eye care, we are in a unique position to create a big impact on preventing blindness in the United States by addressing this one single issue.
And so that's really how you think it's going to affect the future of optometry, is that right?
Absolutely, absolutely. Optometrists are uniquely positioned, not only geographically, but in the communities, to be able to detect glaucoma, to be able to manage glaucoma. Most states allow optometrists to manage glaucoma right now. And that first intervention is critical in preventing blindness. So I think that glaucoma is going to be a public health crisis. Our ophthalmology peers have been raising the alarm on this. How well is it that we're positioned to be able to tackle this challenge depends on us. So I think that that's crucial, and driving that message is really important for the optometry community.
And quickly, so then what's your takeaway? What an optometrist, a practitioner watching this?
I think that we have to develop better skills at detecting the undetected, at diagnosing the underdiagnosed or the undiagnosed glaucoma, number one. I think that we have to look at technology in a different light. Oftentimes we have a lot of information, but we don't know what information to look for. So I think that creating a little bit more knowledge in the information that we gather is important. And lastly, I think that taking the message to our communities that people need to be screened for glaucoma, especially if you have, risk factors, family history, race, age. It's important driving that message to prevent blindness. And that's the opportunity that we're faced with, and that's an opportunity that we can embrace very quickly, very easily. We have a lot of the tools, we have a roadmap. All we need to do is follow it.
All right, good advice there, Dr. Gonzalez. Thanks for being here.
Thank you.
We appreciate it. Thank you all for watching Optometry TV.